Welcome to our video number 2. Last week we learned about what the symptoms of acute and chronic toxic metal toxicity is. And this week we're going to talk about how to safely deal with toxic metal in your body when you have adrenal fatigue syndrome. And so there are multiple things that you can do when you have heavy metal toxicity. First thing would be to obviously eat correctly. The more fiber that you have in your body, the better your digestion, the better you're able to detox out. But talking about detox, what is the right type of detox?
This is a very tricky question because as much as I like to say that, well, okay, just go ahead and do a cleanse, the reality is that heavy metals are hard to detox without a proper procedure. And by that, what I mean is proper preparing the body ahead of time. Now, I'm talking about people who have adrenal issues. We're not talking about normal, healthy people. In adrenal fatigue cases, many people already have a toxic body. They already have maybe a genetic issues. Their body is overloaded. So when you have on top of all these irritability, you have the heavy metal, and you try to get rid of the heavy metal, you can cause what is called known as a retoxification reaction and trigger adrenal crashes. So the lesson to learn is that you don't want to detox unless the body is ready. And in our neuroendometabolic therapy, we pay great attention to this because the right thing done at the wrong time can actually be wrong. And not only is it wrong, it will also be very, very painful for the body because the body can go into crashes when you do that. Okay, so beyond all things, it really comes down to experience because what is known in terms of how to get rid of these metals are known. We know them. But what delivery system, what frequency, what duration, when to pause, when to take a holiday, when to step on the gas, when to go through cycles, when to pause. These are all very tricky questions, and everybody is different, especially when they're in adrenal fatigue.
So it's very important to know when and how to be able to detox depending on what stage you're at. And the only way you can know that is really by knowing your body and maybe having professional help to be able to help you through the little detox that you're getting. A lot of people actually go through chelation therapy. That's the first thing they hear of when they have heavy metals. What do you think about chelation?
Well, chelation is okay. There are different forms. You can do it naturally with green food, chlorella, spirulina. You can do it some alpha lipoic acid, glutathione is very good. But all of them, again, there is no bad substance, so to say, because they have all good properties. But the good property doesn't match with the right body, actually creates more problem. Even just glutathione alone, there's so many delivery systems, you see what I'm saying? If you don't do it right, you can actually cause liver burden to increase. And it's not unusual for people to take liver supplements and feel, they actually feel worse. They had actually more brain fog. And these are some of the warning signs that it's the wrong thing to do. Perhaps it's the right thing to do at the wrong time. Maybe it's the wrong thing to do at the wrong time. But there's one thing for sure, is that if you don't do it at the right pace, right frequency, right duration, at the right time, you're not going to get the results. And that is ultimately many, many people experience when they self-navigate.
So how do we support the body when they're going through getting these toxic metals out of there?
Well, it's almost like it's almost like riding a bicycle. It's very hard to just ride it with one foot. You have to have a right foot, left foot, right foot, left foot that's in sync. So when you try to do a detoxification system process in a adrenal fatigue setting, you always have to be mindful that you're never detoxing alone. You always have to support the adrenals. Sometimes you need to take breaks, sometimes you don't, sometimes it can be overwhelming. So it's all that synchronization that comes with a lot of experience. So detoxification, especially heavy metal, is easy to talk and the compounds are known, but unfortunately the end result oftentimes is failure, not because of the compound, but because of operator inexperience.
So be very careful if you're thinking about detoxing from your heavy metal toxicity and you have adrenal fatigue. And that's what we have talked about today in this video, that you have to know how and when to do it correctly.
And the speed is very, very important. Fast is not necessarily better, so please pay attention.